making at the national level. So that's two areas of advocacy currently ongoing that my organization is involved in. At the same time, we're building the capacity of community organizations to participate in this level of advocacy because they're the ones located in the local level, and we're trying to facilitate their relationship with their local government units so they can be part of decision making at the local level.
Thank you so much. That's quite detailed. I'm thinking, so we have that level whereby we are investing in our communities to be able to voice their concerns to the local government to up their game and to stop thinking about, oh, funds will come from the national government. But also there's the other angle that you have also raised that I find also quite interesting. You mentioned that the national insurance does not cover DRTB. So then that's another angle that we need to start thinking because we know what that implies to families and to individuals.
Drug-resistant TB meds currently are supported largely by donor funding. There are a number of local government units that are wealthier than others, and they are able to procure, but only for their constituents. So it's also not available to everyone, only for those who reside in their cities. But yeah, with the increasing number of drug-resistant TB cases in the Philippines, it needs to be part of the national health insurance so that it becomes free. Drugs for susceptible TB is completely free as long as they access it from the public health system. And as long as they have national health insurance. And that's where UHC actually comes in because UHC is supposed to guarantee that each and every Filipino is covered. And when that happens, that means that with the integration of the drug-resistant TB meds in the insurance, then people won't have to carry that out of pocket, and we don't have to rely on donors for supplies of the RTB meds.
Thank you so much. Any other inputs? Yes.
Good morning. I'm Leia Tambot, President ng Samahan ng Lusog Baga. At the same time, KP, representative of the PCCM. My stand is stand for our community, and in terms of financing, we would like our community, not only my organization, but at the same time other organization to organization capacity building because we only, as a leader, we capacitate, but our members, we would like also to capacitate also our members on the ground so that they can train also their members on the ground. And number two, we would like to have support from. We would like to recognition of CBO at our regional and RTH, especially when every organization have a chapter which can be part of health promotion, education, case finding, and case holding. And number three, we would like to have a finance in strengthen the TB community involvement in community-led monitoring to ensure service delivery improvement, capacity building, and accountability. And then, policy change. Number four, we would like to have a finance in encourage local representation in TB CBO development because when it comes to sustainability in every organization, so maybe we could, it's better to help us how to collaborate in the LGU for this sustainability in terms of finance. Thank you.
Thank you very much. I'd like to pick something that you just finished with, that collaboration for sustainability on financing. I really like that idea because then we are moving from saying we need more money. We are saying what do you have and what do I have and how do we make it work? But then something else that was said by the previous speaker is that we need the capacity building process. That means it doesn't necessarily mean training. It just means that who do we network with? Who is the nearest person that I can work with to help me think through what I have and maximize on what I've got. And I'm also thinking, the Philippines, yes, it's devolved government. Most governments are. So then we have the various levels of decision making. And what I hear is, it's not about policies anymore. It's about how do we ensure where we are at. We are reaching everybody with the information, that everybody gets to know what it costs to have proper access, and then just seeing what else can we do to ensure that we have access, that our family members, our community members, our people are healthy, right? So it's quite an interesting conversation that we are having, and I'm keen to hear from other countries what their experiences are, or where else can we plug into. I know most governments are moving into either integrated programming or UHC or primary health care, and what James has challenged us on when we started is, how do we access that port? Now we are hearing, if we collaborate with whoever is within our circle of influence, then we are able maybe to access that port, right? If we start having conversations at various levels, maybe we're able to access that port, because it's about strategy. Yes, the money is little, but how do we package our issue, whether it's advocacy, whether it's training, whether it is access, to ensure that we get to what we require? Because we know, that, as we heard from yesterday, the same person could be having multiple medical conditions or vulnerabilities. How do we use that? How do we change that into an opportunity as opposed into a challenge? Because we know we have funding in other areas, okay? We have finances in other areas. How do we ensure that we dip into that port? Any other experiences we want to share within the room?
Hi, I'm Lisa Stevens. I work for Family Health International, FHI 360. So coming at it from sort of a different perspective, we support projects, the TB innovations projects here in the Philippines, TB private sector in Indonesia, projects SET TB in Vietnam. So quite a few projects and some work in PNG and HIV and COVID. And I think when we talk about financial gaps, I think from the innovations perspective, and look at the difference between what was able to be achieved in the COVID response and how fast that was achieved versus how slow we are with new innovations. And we know that something like a tongue swab and a vaccine that really works are necessary. We need to be like HIV. You bring somebody in, you can test them, they know they have TB, they start their medicine while they're sitting in front of you. I mean, this is what we need to really tackle this epidemic. So looking at, we don't have the huge pots of money and the massive political influence that COVID did. But what can we do with the money we have to move these innovations faster and get them to the countries and then to subnational and actually down to the people who need them? So I think, I think of diagnostics and vaccines and treatment, obviously, and also this UHC and healthcare. So we know countries like Vietnam and Indonesia and the Philippines have a national health insurance and are working through how to better pay for TB. So it's not completely being paid for by the Global Fund and USAID and external donors. But there's a lot of countries that don't have that yet. And I think there's a long way to go. So those are just some ideas on the top of my head that's very different from kind of the real country level look at it, but something we need to think about and keep working on. Thanks.
Thank you so much. Thank you for the thoughts and the comments. I like the way you say that we have to take cognizance that there's some countries that have it and some do not have it. And even the ones that have it also have struggles. And they're already thinking through how innovative can we get to the point whereby we are closing the gap. But then, I don't know if we have any in the room, any country that is represented that does not have that kind of national insurance, because that's very critical. I know of other countries in different regions, but I'm not aware of this region as such to know if there's a... You want to say something? Okay.
Hello, good morning. I'm Edwin Candido, member, actually founder and leader of TB League of Volunteers in Cavite area. I from CBO and member ng PAS TV, Philippine Alliance Stop TB. The struggle of my group is, before I entered my group, or I made the group NGO or CBO, sige po, ako po ay naging TB patient in 3 times. In the last, ang huli kong treatment is 1999 and nag-end ng year 2000. Nag-decide po ako pumasok sa isang NGO at nakapasok po ako doon sa faith-based organization. Ang struggle namin dito ay yung saan kukuha ng pondo, bilang TB treatment partner, walang resources ng ang mga volunteer na katulad namin na dating pasyente. Almost 23 years na po ako sa TB advocate. 23 years after kong maging TB patient noong 1999. Then naisip ko na dahil ako yung natasan na maging TB ministry leader at the time, nakita ko yung tao come and go in 6 months. Doon naisip kong gumawa ng grupo, ito nga yung TB League of Volunteer. Nung ginawa ko yung TB League of Volunteer, kung struggle kami sa pagiging volunteer as treatment partner, nagkaroon pa kami ng matinding struggle dahil yung case finding and case holding, nadagdagan pa ng advocacy. Nakakagawa po kami sa grupo namin ng advocacy group like March, like this month. World TB Day, barangay version. Wala kaming pinagkukuha ng pondo o budget, pero nagagawa naman namin ang paraan. Pagdating ng months, nakakapag-create naman kami ng Langman celebration, nag-create kami ng activities like Zumbaga or Zumba for the lungs. So, lahat naman yung nagagawa namin, pero ang pinaka-struggle namin dito, although kinikilala kami ng CHO, PHO, regional, and DOH, hindi naman kami kinikilala ng LGU. So, ang mga suportang pinagmumulan ng aming resources ay mula sa mga volunteer. Actually, lalo ngayon, walang TB meds. May mga sponsor kami na nag-sponsor ng tumutulong financially para makabili ng gamot. At doon, natutugunan namin yung mga pangailangan. So, saan kami pupunta katulad naming NGO? Na actually, 23 years na ako sa TB volunteer. At hanggang ngayon nararanasan ko yung hirap. So, hindi ko po alam kung saan kami kukuha ng maayos-ayos na sponsor or tinatawag namin na resources. Pero, hindi naman po talaga kami nag-i-stop dahil wala kaming resources. Lalo naman ako, dati na po ako nagka-TB, parang ang aking puso talaga ay nasa TB. So, sa abot na aking makakaya, lahat ng lumalapit sa akin at lahat ng naabot namin ay possible nagiging TB patient sa abot ng aming makakaya. Yun lang po. Maraming salamat.
Thank you very much.
Okay, so Edwin, he said that he's been a TB patient 3 times in his life, and the last treatment he graduated from was in 2000. And since then, he joined a faith-based organization to help provide support to other TB patients in their communities. Essentially, he's been a volunteer for 23 years. And his experience has shown him that although they have volunteers that are willing to do the work for free, the range of work that they do has also expanded. So they do case handling, they do case holding, they become treatment partners, but they're also engaged in awareness raising and advocacy. And even though they're able to mount some of these awareness campaigns on their own, they really struggle with financing this and sustaining the work of the organization. So they depend largely on the money that their volunteers are able to pool. They get support from the Department of Health, the regional office, the city health, but the local government does not always acknowledge their efforts, so they find it hard to access resources from the local level. So essentially, although he's saying that they continue to work despite not having enough resources to do that, and they depend on their own available resources to help, even to the extent of providing financial assistance so people can get medicines when there are no available medicines in the public health system. They do want to continue the work that they're doing as an organization, but they need resources. And he's asking where these resources can come from.
Oh, perfect. Where do the resources come from?
Thank you, Edwin. Salamat for sharing your experience. Maybe just from the financial perspectives, I think one key topic that we would like to discuss is on mobilizing resources. And for that, we need to understand the financial landscape. Because I think Lisa mentioned, and I think from your experience, country's experience, I think James also brought up several countries' experience, and you are asking which country doesn't have social health insurance. So different contexts, right? So that's why we need to understand the landscape of financing for each country, where the money are mainly coming from. I trust that some of the countries, especially with higher global TB burden, are still relying a lot on external financing, global fund namely, right? But it's not going to continue forever, right? So understanding where the money comes from in each country will be very important, the landscape. Also then understand what is the capacity of the financing of that country. If that country still relies a lot on external financing, then maybe we need to make sure that at least it will continue and there's some money allocated for TB from these external sources. But for countries that already have financial capacity to finance from their own financing resources, we need to continue to make sure that the money that each country generated for their own revenue can be allocated for TB, right? So this requires a lot of raising awareness, or awareness raising efforts, what is it called, social awareness and so on, right? Especially among decision makers. So that's quite important. And then we need to identify if local financing, meaning domestic financing, is the main sources of financing, how it is channeled. Is it through the government budget or is it through social health insurance? So that's, if countries with social health insurance, we need to think how TB services can be integrated into the social health insurance financing, right? Is it through benefit package? And how it is going to be financed. And how the financing through benefit package will be channeled or will be paid to the providers, because that will be very important, because these entities such as PhilHealth, BPJS from Indonesia, maybe from other countries, has the power to influence providers' behavior through payment, right? So this is very important, how to efficiently and effectively use the money that you have, that each country has. And if it's channeled through government funding, if government doesn't have social health insurance through government funding, how this government funding can be used effectively. For example, a lot of government has limited public capacity. To reach out to TB patients, they need to involve community, but they don't have the means to channel public money to community, right? Sometimes, maybe oftentimes. So they say that, oh, we have public financing, we only use public financial regulation only, that it has only, that the money can only be executed by the public entities, right? So this is a big hurdle, because to reach out to TB patient, you need community, you need CSOs, right? So making sure that there are means from the public financing to be channeled through the civil society organization community also needs to be there. And in terms of capacity, how civil society organization understand that there are money available in the public sector, right? Usually public sector is very secretive about keeping their budget document or budget activities. So making sure that there's a communication between the public sector and the CSO is also important to make sure that the money can be channeled and can be executed at the civil society. So this is only a thought-provoking ideas that first we need to understand the financial landscape, and then the available means to use the funds, and then the next question will be on efficiency and effectiveness. And I think Global Fund brought up issue about innovative, ADB brought up the integrating into system, but that's about efficiency. So I think the first part is understanding the financial sources. So,
Liz, can I respond? Yes. Some of the things he said. Thank you for raising those concerns. So in the context of the Philippines, I'd like to raise three main things. One, the TB program has always been just largely medicalized. So it's only the health sector investing in TB. But we need to look at the non-health sector that we have not tapped. So I was asking Edwin earlier, because they do a lot of assistance to other patients, but they've never tapped social welfare. There is available money in social welfare to provide medical assistance and financial assistance. But because the strategies for the national TB response is mainly focused just on health, the other sectors are not also aware of how they can contribute. And this is a set of financing that has not yet been tapped or maximized because they're not engaged. And I'm saying that because in the experience for HIV, they are being tapped. In the same way, when you talk about how to channel government funding to the civil society organizations, the Philippines actually has a policy framework for social contracting, meaning government can actually contract civil society organizations or community organizations. Of course, they have to follow the accreditation requirements of government, and they have to be eligible, and they have to also be able to show that they have capacity to deliver services. But there is that availability, and we're already doing that for HIV. We've trained civil society organizations. They have been able to demonstrate their capacity to reach marginalized communities that are unreached for HIV services. And there are local government agencies that are already willing to fund them. So that is happening. The difference with HIV and TB is that we have a very long history of community engagement in HIV, to the extent where community organizations are actually able to deliver services. So we have a community-led organization that is already accredited by PhilHealth. They provide the outpatient HIV treatment package, and they also have a TB DOTS facility. So that means they're able to reimburse both for TB and HIV from PhilHealth, so PhilHealth coverage. So that's possible because there is an openness to among stakeholders that community organizations can deliver HIV services. Currently, that's not the same for TB. And we haven't actually gone through the exercise of identifying among all the range of services needed by the TB community, which ones can communities help deliver? Does it have to be in the health, does it have to be health services? Maybe it's about stigma reduction. Maybe it's about generating demand. But if government requires those so that the uptake for services is maximized, so that we are able to notify 100%, then maybe channel funds to community organizations like Edwins, who are able to actually reach the communities but do not have the resources to do that. And the policy framework already exists. We just need to demonstrate that. So I guess that's critical for us. The non-health sector needs to be more engaged so that they understand their role in also providing services and contributing to the end of TB, and maybe, bridging the gaps in catastrophic costs, as well as social determinants for health and stigma reduction that are all coming from the non-health sector, and looking at ways to elevate the capacity of community organizations to a point where they're able to contract with government.
Thank you so much, Mara, for just bringing all that in. Thank you so much. From the conversations, anybody else from the room before I make an interjection? What I'm hearing is there's so much to be done and there's so much going on. But then the power lies in the information that we have and the information that we can access, and who are we talking to, right? We have structures that have worked out well. But as a sector, at the TB sector, we still have lots of learning to do and borrowing and just observing to see how we engage. I like to pick on something that Mara said, that we are heavily medicalized, that the other issues that really affect us, because it's about the human being. It's just not the condition, the disease. It's just not me being a TB patient. It's me as a human being. How do we access those resources? And we know most governments are struggling. I mean, it's a huge machinery. There may be funding. The processes may not be working good, but we know as citizens we have to aim for some access. But then how do we access that if we do not have information? And if we have information, how do we use that information to get us to where we want to go? What I hear from the conversation so far is that we need to start thinking differently. And we talk about capacity building, we talk about partnerships, we talk about networking. But there's a word I want to introduce into this conversation: negotiation. How do we negotiate our space as TB warriors, as people in the sector, that we are able to engage with social services, we are able to engage with the private sector, we're able to engage with the people that would not normally speak to? Because if you look around this room today, we are all TB experts in one way or the other. How are we supposed to get the other money that ideally we wouldn't get on a normal day? Because that's what we're looking at. We're talking about UHC, we're talking about government systems that work in other places. How do we get to that point? I think one of the things we need to start thinking, we need to shift a bit, is we have to learn how to negotiate. We have to make TB everybody's business. That is just not about, when you talk universal health coverage, why is TB not part of that universal health coverage? How do we negotiate? We have to learn to do that so that we're able to access the little that is available for the others. Your hand was up.
Thank you. I'm Dr. Margaret Carl, National TB Program Manager for Papua New Guinea. And I have with me Honorable Robert Baguri. He's the Deputy Chair of our PNG Parliamentary TB Caucus. So this morning I will share some experiences. From the program level, we have seen that the gap for TB remains high. It doesn't mean there's not money around. We have seen that there's money.
So this is our second panel. I have the privilege to moderate this panel. My name is Chief Austin Arinzo Biefuna, the Vice Chair of the Stop TB Partnership. And this panel will be looking at concrete actions that different stakeholders can do in 2024 towards increasing finances for TB response to end TB and also achieve the UNHLM commitments. So I have the privilege to invite Eliud from the Global Fund, Sam Cooney from the Jihit Fund, Japan, Dinesh Arora from ADB, the Asian Development Bank. Please come up the stage. We have Pandu Harimurti from the World Bank. We have Nuru Lengtungan from the Stop TB Indonesia. Muatang En, the Undersecretary of the Ministry of Health. We have Leo Ray Tejares, the focal point for child lungs and a member of the Philippine Alliance to Stop TB. And finally, Rosalind G. Vianzon from the Philippines. I try to create a gender balance because from the initial list I have, I didn't have a lady here. So please clap for them while they make their way to the... So if you look at this, it's just, I don't want to use the word finance. I want to use the word money. It's more preferable because everybody understands the language of money. So if you look at this panelist, it's quite a rich personalities that has ways of opening doors for money. But before I start, I will want to give 1 minute to each of the panelists just to introduce themselves before we move on with the business of the day. So I want to start from here, please.
Yours truly is Dr. Rosalind Vianzon from the Disease Prevention and Control Bureau of the Department of Health, Philippines. Right now, I'm working back with the Tuberculosis Control Program and the HIV program, and I've been tasked for the group to report back what we have discussed fruitfully in our discussion this morning. Thank you.
Hello, good morning. Again, my name is Eliud Wandwalo. I work with Global Fund as head of TB at the Global Fund. I've been working in TB for so many years. Nowadays, I don't regard myself as a TB person. My passion really is to see how TB is interfacing with other disease, other areas, and this is what I want to be described at the moment, not so much as a TB expert.
My name is Sam Osamu Cooney, but call me Sam. I'm a CEO of a Global Health Innovative Technology Fund called GHIP. But previously, I worked with Eliud as a head of Strategy Investment Impact Division of Global Fund.
Thank you. My name is Pandu Harimurti, Senior Health Specialist, currently based in Jakarta, World Bank Indonesia. I've been working with the bank almost 20 years, and mostly I spend my time on health system and health financing issues. But currently leading a TB program for results project, which is an innovative financing in collaboration with the Global Fund, because it's a buy-down project with support as well from the Bill and Melinda Gates Foundation. Thank you.
That's my name is Nurul Luntungan. I'm the Chief of Executive Board of Stop TB Partnership Indonesia. But I would say in TB currently I'm wearing multiple jackets because I'm also the PR for the Global Fund for the TB community. And I'm actually working as a consultant with Papandu in the World Bank for the TB P4R. So I just work in TB in 2021, but currently I'm exploring a lot of things and working in multiple works in TB in Indonesia as well.
Good morning. My name is Mao Tan Ying. Just call me Mao or Dr. Mao. I'm a former NTV manager. I had been working for TB too many years, from 2001 to 2020. I retired in 2020, so I'm now currently under Secretary for Health on behalf of Cambodia. So thank you.
Thank you and good morning. This is Dr. Dinesh Arora, Principal Health Specialist and Director in Charge from Asian Development Bank. I have worked a lot on TB earlier, and presently in Asian Development Bank we work on health system strengthening, pandemic preparedness, vaccines, therapeutic diagnostics, climate change and health. I think exploring how further we can work on the TB field also. Look forward for some excellent learnings and sharing. Thank you.
Mabuhay and good morning, everyone. I am Leo Ray Tijares, the President of Chilang's TB Support Community Incorporated from the Philippines, and I am a MDR TB survivor.
Thank you very much. Obviously, these are money handling experts, not just TB, and we'll be hearing from them on how we can actually open doors, for money for TB. But before I do that, we realized that we are in groups. We had a lot of discussion in our groups, and the panelists, we are staggered in the groups so that we can report back from what happened in the group. But again, we also want to hear from them as well, how they can open those doors for us so that we also bring in more resources, more finances, more money into TB. I will start by giving the floor to Rosalind to tell us what you discussed in your group. Thank you.
Okay, thank you. In our group, we were composed of various representations. There were people from the government, and also a CEO was present. Also, a retired professor was also present in our group. Bureau directors also from government, and even private sector, and even regional level. So the discussion was really diverse, that it looked into the following things that we have discussed as a commonality in that discussion. First, when we think of increasing domestic resources, we're looking really into coming up an analysis of where the gaps are. So a financial mapping would really be very essential, and therefore from that financial mapping, you'd be able to see where your financial gaps are. And in so doing, that's where you can see how your resources can be allocated into those gaps to address those gaps, but not considering only the domestic resources or the country resources, but also looking into other possibilities to really address those gaps. So that's where the value of financial gap analysis and financial mapping was being adhered into. Next, we also considered looking into some TB indicators, monitoring indicators that will look into how those gaps are being addressed. So it's not the routine program monitoring that we're discussing here. It's really looking into the monitoring of indicators, looking into how the countries are addressing those gaps and where the other resources are really being put into play in terms of supporting the country's needs. The next discussion focused on some external finances. So we've had domestic resources. Now we look into discussion of external resources. This was the most important discussion of the topic because we have considered aspects related to World Bank mechanisms, ADB, COICA, and the rest. And in here, the main call was really remove that misinformation that if you have global fund in your country, period, it's enough. You stop from there. Where in fact, it shouldn't be. It should be really considered as a multi-sectoral approach even for addressing financial gaps, and therefore having presence of Global Fund should also be looked into by having the different resources that we have in the pipeline. That's where we look into how these mechanisms from other resources can come in. Likewise, when we talk of these external finances, we're looking into how TB is now being integrated into the current situation that we have climate change, that we are looking now heavily into pandemic preparedness, health system strengthening. And therefore, it has evolved now that TB should not be seen merely as a disease by itself, but really an overall part of a system addressing the health system of a country, wherein in every aspect, TB should always be integrated into such. Nonetheless, though, when we talk of all these resources, the integration and the likes, increasing TB funding, there is also a consideration that there should be due consideration for absorptive capacity. Sometimes we may have all the resources in our hand, but there can be some limitations or discussions related on absorptive capacity. Simply saying it's just like you cannot swallow what you cannot chew. So you just have to really be sensible in terms of managing these resources, because these are also part of the TB funds. And the third discussion was on out-of-pocket expenses. Out-of-pocket expenses really dwell into more on the private sector and also on the patient side. While there are vast resources flowing into the country to address TB, but when you look deeper or deep dive into the lower level, which is that of the patient and the private sector specifically, there's still really some costs in being entailed by this level of people. Patients would really spend still some amount of money to pay for their transportation, would spend still an amount of money by being, let's say, not going to work on that day, so they lose their daily wage. And for the private sector, there's also still additional expenses or costs that looks into how they can maintain their clinic to address all these TB patients. So the out-of-pocket became a discussion. And in here, we're seeing into how the value of health insurance mechanisms, vouchers, accreditation, and even some top-up expenses or top-up additional fees for the private sector to really entice the people to have their tests and to have their treatment being undertaken regularly. The fourth discussion was really on the CSR funding. Because we have a CSO present in our group, the CSR funding was brought into the discussion table. And in here, we're looking into creating some kind of an organized structure where CSR funding can also be considered part of the mapping out. CSR is really seen corporate by corporate, but looking into it holistically and more structurally and perhaps being efficient about it, perhaps an organizational structure of how CSR funding can be put into place into countries would be a better source. And then, well, not really lastly, there's also a discussion on this crazy rich people. I think it was Dr. Tichanda that raised this concept of crazy rich people, that they should consider also TB to be part of the rich people's world or rich people's mind, that they may be crazy for other things, but they should also be considering that TB should be part of that richness that they have or that craziness that they have. So it's just really a matter of making TB aware to these so-called crazy rich people. And then relative to the CSR discussion was that of the philanthropic approaches, in which philanthropists in countries can be considered really, again, also a source of external funding. It may be that of how philanthropists can be supporting what I mentioned earlier at the family level or at the private sector level, because more often than not, philanthropists would really look into the most affected population, and therefore that's talking of patients. And then lastly, we have considered some village funding, which means that even at the lowest level of implementation, there should be also some kind of resources being poured into TB works, and there should also be some grant funding for public resources, and of course some charity institutions that can also be considered domestically as other sources of financing. So given that whole gamut of resources, which we divided actually into domestic and external, external resources should not really be seen only that of Global Fund. That's the message there. There should be seen other resources coming from various countries, and resources should not only be seen for those addressing TB specifically, but this is the right time that we consider TB to be integrated into other possible sources, given that we are in this scenario of climate change, of pandemic preparedness, and the like. Thank you. That's the discussion we've had in the group. There are
Thank you.
questions. Let's ask the group members.
Thank you, Rosalind. Obviously, you cannot swallow what you cannot chew. I mean, I can see that you had a very rich discussion in your group, because the top highlights are around the mapping of domestic resources, innovative financing, climate change, which is actually on the top of most countries' priorities, health system strengthening, integration, and also, most importantly, philanthropy. You know, for me, I think philanthropy is something that has been missing in TB. And if we can get people like Elon Musk, that's why we want people like the World Bank, ADB to open the doors for us, so that we can also have access to such philanthropic, generous money. So now I want to bring in my friend, Eliud, our friend actually, from the Global Fund. But just to tell us what you discussed in your group, probably later we can also have what you can do personally. Thank you.
Thank you. I don't know even how to summarize, because it was an extremely rich discussion. It was a diverse group with a lot of new out-of-box thoughts and ideas on how we can bring more money to finance the TB response. But before we started discussion, I think there was a reflection from Lushika and other. Why did we find ourselves in this situation where there isn't enough funding for TB, given the magnitude and the severity of the disease? And I think it was agreed that this was because that we were not ambitious in the TB area. And that's why we found ourselves with a little money. And one good example which was given is what in the Global Fund, when the disease split of 50, 32, and 18% was decided, it was historical because of historical data. They looked at their proposals. 50% of demand was coming from HIV. 32% demand was coming from malaria, and 16 or something demand was coming from TB. So it's not like someone imposed. It was because of the historical data. So we found ourselves in this situation because of lack of ambition. And one can go further and ask why lack of ambition. We didn't discuss that, but there are a lot of thoughts why we didn't have ambition. But one theory was the way TB was set up, based on the DOT strategy, because DOT was sold as the cheapest way of doing things. I think there was a confusion between TB being a disease of poor and having poor strategy, cheap strategy. TB is not cheap. So that's how it was sold, and then probably that damped the ambition. There are so many reasons, but I don't want to go into that. But I think there are two main principles which were discussed for this to reverse the situation. First is to have a very good, ambitious plans. So that should be a very fast starting point. So this was agreed as a principle, overarching principle of being able to get funding, is really to come up with an ambitious, good plan which encompasses all aspects and what does it take for us to be able to end TB. So we should have that big, ambitious plan. So that was one. And then the second aspect which was discussed was to ensure that TB response is fought within health system response. So we should not sell disease, TB as an isolated specific disease. It should be tackled, it should be seen as part of the solution. It's not a part of taking money, but it helps other elements of health system. So when you invest in TB, you are actually investing in the health system. So those are the two principles which we have discussed. Now, in terms of the details, we also had a very good discussion. We divided the discussion between domestic funding and external funding. And external funding, that means external to the government funding, be it international, be it from private sector, be it from philanthropic, or coming from other sources. So we divide that one. And one thing about the government funding, we need to foster collaboration within government system between the ministries of health, Ministry of Finance, and other ministry. There is money within the government system. If we are smart, we will be able to tap funding which are available within the government ministry, be it from the Ministry of Agriculture to do with nutrition, be it from women ministry, etc. So collaboration within government system is very important. The other issue which was mentioned is to do with the legislation, regulation, policies. They are not very clear in terms of how that policy can make money accessible to be. And many examples were given. One example, I think countries which have presidential decree and others, how do you translate that into giving money? Because some legislation, they don't allow, for example, to give money to private sector or to CSOs, and we need to make sure that we look at that. Earmarked funding, or sin tax in other countries, that was also highlighted. And here it's not for TB, it's general for health, and TB can tap into that kind of funding. And this goes also with insurance schemes, social protection schemes, etc. It was also mentioned that there are some areas which are very difficult to be able to get domestic funding. One area, for example, when you look at the migrant issue, many government or domestic funding, they don't want to give money for migrants which are in this country. I think this is one of the challenge, and also other vulnerable population. It's very difficult for domestic funding to target on that. We need to make sure that we make a case, but probably these are the areas which can benefit from external funding, not necessarily international funding, but external to the government funding. In terms of the private funding, the corporate social responsibility was mentioned. I don't want to repeat. Is exactly from the first group. Private funding, philanthropic funding, and I think an example of India was mentioned, where they have a system where rich people or even normal people can adopt a TB patient and be able to generate money. So this is like peer-to-peer, support-to-support, people-to-people sort of funding. In terms of CSO, government needs also to allocate money for CSO. It's very difficult for most government to be able to support CSOs. But also, we also saw that CSOs also need to come up with a plan. They need to be responsible in terms of how they use money, transparent, so that they should be able to attract funding from the government, but also looking at legislations and also policies. They should be friendly to be able to support private funding. In terms of the international funding, I think one thing which was discussed is to look at the global health funding, which is available, not necessarily a TB, to set up a TB funding, but to look within the global health funding, pandemic funding, all the fundings which are coming to ensure that TB benefit from that. And we need to make a very strong case in terms of how TB can benefit from that. The issue of efficiency and coordination was also mentioned, that we need to be very efficient with the funding we are having. Several examples were given of inefficiency, and that efficiency is throughout, from the UN organization, from private NGOs, international NGO, so that we should be able to maximize even the smaller amount of funding which we have. I'll stop there. It's a lot of good discussion. We have notes, and my colleagues from the group can add. I'm sure I've left most of the rich discussion, but I think it was a very exciting discussion in the group. Thanks.
Thank you, Eliud. Your co-participants in the group will also have the opportunity to speak at a later time. So from your presentation from the group, I heard that lack of ambition, which is very clear, you know, from TB programs, from countries, and you also talked about philanthropy. I mean, you gave an example from India, which I know that Luchika also adopted a few people in India that she's supporting to go through their treatment. I think this is something that we should also, and see how other countries can also probably understand how this works. So that's why we will always talk about South-South learning as well. You talked about the disease split a little bit, but most importantly, reimagining TB. We need to change, you know, the dynamics in TB. We need to be more ambitious, which is very clear to me. And also you spoke about CSO, which is very key, I mean, very key to my heart, the CSO funding. And I can assure you that a lot of interventions are happening in terms of CRG, which also the Global Fund is also supporting, together with the Stop TB Partnership, where they can understand the incidents in their country and also how to support the program. So I think the CRG, Community Rights and Gender, the CLM is actually working in those countries. So this is good, but most importantly, the policies. Policies also kind of restrain countries from also being a little bit ambitious. Probably they should also look at it, and you know, in terms of their insurance and social protection. That now brings me to Sam. I know that Sam is an expert in the global health landscape, you know, funding landscape, not just because of the heart he wore earlier in the Global Fund, but also with the GHIT Fund. Before you talk about personal experience in that, I want you to share what you discussed with your group. I know that you had also a very rich discussion in your group. So, Sam, you have the microphone.
Yeah, thank you very much. So we had a very good discussion with a good mixture of, civil society, government, local government, Global Fund, etc., from Myanmar, Indonesia, Vietnam, etc. So I just want to summarize with the 3 points. First, okay, already, two presenters really show that kind of duplication. But, in addition to robust planning, we also need detailed costing and budgeting and privatization, because sometimes, we are kind of missing. And we also need kind of good tracking of these expenditure, through the system of health accounts and etc. Otherwise, we could not use that properly, efficiently, effectively. So those kind of, planning is very, very critical. And And second one is, of course, funding sources. We need more money. And from, Global Fund, actually we discussed a lot how to just increase that amount of money to, the TB. But at the same time, we almost 70% of, maybe more than 70% of the TB expenditures from domestic financing. So we also need to increase that domestic financing. And also private sector, already you mentioned that the private sector, etc., but we need some kind of tax exemption and other incentives. And the crowdfunding or other innovative financing is quite important. As you know that, ADB, even, that they say that there is no kind of good demands or a request from the government. So we also need kind of demand creation or better planning, for good request for, the ADB and others. And in Global Fund, we also discussed that the innovative financing with ADB, World Bank, and etc. So maybe you can also utilize those. And, it is not only just direct financing, but also indirect financing. So we can also mobilize resources from World Food Program or UNICEF. For example, I worked in UNICEF for 7 years. At that time, no one talked about the TB, right? Although, the TB prevention of, children is very critical. So we really need to sell that kind of things. And we asked then, the UNICEF, to put, the child TB issues, prevention and others in their packages, right? And even WFP, providing good food and nutrition to, the people in poverty. Also a really good prevention of TB and even, the good treatment. So we need also think about those kind of resource mobilization, indirect one. Third one is a social contract. Actually, there are several, social insurance and social contract, UHC packages, etc. So we really need to put that, the TB components in that. And we really need to engage that communities. For example, that we, Global Fund, provide a lot of money to CSO, but it is not sustainable. So we need to push government and also local government to engage, communities as a really important implementing partner, not as volunteer, but paying for that one. Because, the local government cannot provide all kind of services. So they really need to, that make most of civil societies and the communities. And we know that even in Myanmar, there are lots of, community-based, the societies, even, the Buddhist and Christian and others. So even informal sectors or informal, community, people need to be engaged. Lastly, I also want to mention that the research and development, actually GHIT, the Global Health Innovative Technology Fund, which I'm doing that CEO, is promoting research and development. As you know, without real innovation, new tools, we cannot bend the curve to reach the, the ending the TB by that 2030 or 35. So we really need to increase the resources for research and development. Actually, currently only 50% of research development demand for TB is field. So we are working with the Gates Foundation, TB Alliance, and etc. And we need more kind of alignment and collaboration even between the funders so that we can avoid a duplication and also kind of accelerate that research and development. As you know, the pandemic preparedness response, we really need to make most of this momentum, right? And the future pandemic also might be a respiratory. So we had a kind of a good discussion after the UN high-level meeting. I invited Eliud and the other people, even CEPI, we invited, and we discussed how to make a synergy between pandemic preparedness and TB, for research development and access and delivery. So we really need to make most of those, especially, for better diagnostics, using urine, for example, for screening. And of course, as you know, the CAD, the X-ray, AI-based one, and even AI-based discovery of, the small chemical particles and others also could be accelerating our research and development. We are also really, encouraging that experts. Actually, that our funding, only 11% of our funding for TB research and development, because there's not so many, experts and also researchers for that one. So we also need kind of resources for experts applying for, the TB research and development. Okay, I want to stop here and thank you.
Thank you, Sam. Thank you very much. Obviously, we need to track the expenditures, like you said. And what is also coming out clear is efficiency and coordination, because this is very key. And also Eliud mentioned that as well. But for me, most importantly is the connection between UHC, the pandemic preparedness, and also promoting research and development. That is very key. Thank you very much. I now want to bring in Pandu from the World Bank. So probably let's hear what your group discussed. Thank you.
Thank you. So I'll be representing the group at the same time also wearing the World Bank hat. So our group comprises different countries participants. So it shows the diversity of the group. Also participants coming from different sectors, public, private, friends of TB from the health professional organization, volunteers, and TB survivors. So it was a rich discussion, but I would like to summarize the discussion. I think similar to already expressed by other groups, it is surprising how this parallel thinking happened. Number one is understanding financial resources available at the country level. So understanding the financing landscape for TB, for health, for TB, is important for the TB community to be able to tap available resources. So, but this is driven by country-specific situation, right? Because in some countries, they have decentralized settings, so they need to mobilize resources available at the local government level. But also there are economic contexts because some local governments, they don't have fiscal capacity, right? So understanding this situation is important. And also some countries already have social health insurance or national health insurance schemes that can be tapped into to finance TB activities. But some other countries, they don't have this luxury of health financial protection. So understanding the financial landscape in each country is very important. And then under this financial landscape, health TB is oftentimes considered as exclusive to the health sector. But we need to understand that there are financing to other sectors other than the health sector that can be tapped into to finance TB. For example, financing that flows to the social protection or social assistance program that can be used to finance TB as well. So understanding the how financial from other sector that can potentially be tapped into the TB program. But in addition to that, the multi-sectorality of TB needs to be brought up, right? How TB linked to nutrition, for example. There are countries that focus on addressing nutrition, but how we can ride the wave to include TB into that national dialogue, right? So that's one way to bring TB into the national priorities or national attention. The other issue is that related to funding landscape is that oftentimes TB action plan is not well doesn't include financial investment plan. So ensuring that TB action plan has investment plan in it is also an important key. And this information will be useful to raise awareness, to use it as an advocacy tool for decision makers, lawmakers, those who have the authority in resource allocation to understand where to put the money. That TB is a national priority. So it's increasing this voice to to raise awareness among these among these key stakeholders. And then after we talk about understanding financial resources, we need to know where to put the money and how to execute the money to get the most results for TB. And we discuss a lot about the participation of non-state actors, non-government organizations, from CSOs to volunteers, including the community from TB survivors. But the issue is that public financing regulation oftentimes do not have mechanism to channel this financing to these institutions, to these entities. And also that even if the public financial management allows the channeling of funds, sometimes there's still ignorant, maybe it's a strong word, but not realizing that from the public sector side, that not realizing that they can use these entities to support TB. So again, important to going back to the raising awareness, advocacy, and so on. Thirdly is related to accountability. So when we recognize the sources of fund, we understand how to allocate to interventions that give the biggest bang for the buck. We need to make sure that accountability is there, because this will give confidence for the financier to put money to TB, to non-state entities, and so on. So mechanism to ensure how results can be demonstrated, can be verified is also important. So, so those are the key issues. But lastly, that there are countries that still rely on external financing, because external financing is still a key financial component for TB program in most countries. That external financing work separately. So, and they have their own priorities, and they have their own focus of interest, areas of interest. So how to make sure that there's coordination of external financing will require a strong leadership from countries. And this, again, going back to the raise awareness, the advocacy, to make sure that there's a stronger leadership to guide or to drive investment that comes from the external parties. There are countries that have already started doing innovative financing, collaborative across donors, and I guess this can be a source of knowledge that can be shared across countries. So I will stop there, but if members of our team will add, maybe later on will be given opportunity. Thank you.
Thank you, Pandu. Obviously, domestic financing also came up, policies, integration, and also understanding your epidemic, I mean the TB problem in the country and where to put the money. I am aware that some of the panelists shared same groups, so if we can just keep it short, 3 top things that we discussed in your group. Nuru, thank you.
Thank you so much. So I'm representing from Group A. So we also had a discussion, and I think a lot of things has been said by the previous panel as well. So in overall, I think we agree that first we need to understand what is our target, right? That was discussed mainly in our group. What do we need? What do we want to achieve? What do we need to get there? And what components are needed? And where are the funding needs, the funding situations? I think with the Global Fund, I'm sure all the countries that are the recipients of the TB Global Fund, we are required to have the national strategic plan and to map the funding situations and where are the funding gaps and where the global funds contribute and where are the contributions of the domestic funding from the state budget, from the local budget. Although sometimes not all informations are available, so sometimes we kind of just have a sense where are the funding situations and where are the needs. And after mapping the funding and we understand the situation. But I think another point that is also important is not to stop there, because many times when we get into the mapping of the funding and then we just implement the funding. But the question is actually how to increase the financing, how to increase the funding. So we're wearing the advocacy hat now, and this is also the thing that very important is how to invest on the leadership, on the political leadership, on the commitment to make sure that TB is part of our country priorities. Because it's also our common understanding that a lot of this source of funding could be accessed when there's a country demand, when there's asks from the highest political leaders, when there are asks from the Minister of Health, when TB is seen as an important point which target need to be achieved, and it's an important part to strengthen the other health system strengthening options, like to strengthen the primary health care and everything. So one of the key that was discussed is how we can strengthen that. And maybe I could just share a little bit of a story of Stop TB Partnership Indonesia and how it started. I would say thank to Lucika. Lucika one day back maybe 12 years ago talked with one of the Crazy Rich Asian in Indonesia, the founder of Stop TB Partnership Indonesia, Mr. Arifin Panigoro, and encourage him to, you need to be the president of the forum of Stop TB and to have a discussion about TB. And that's how it started. And it started as a forum, and he managed the funding by himself and everything, and he tried to understand what are the things. And then we changed into a foundation, and we support all other things. And it also happens with the Indonesia. We see there's a lot of funding actually coming after we have TB as part of G20 as the side event. That's where you have all the political leaders to actually talk about TB and see that this is still a big problem. And now funding are starting to coming and supports are starting to coming to countries that put commitment to work harder on TB. Even though maybe the support comes from the development bank, support comes from the AIDS organization from other countries, from bilateral fundings, and also another support comes from works that actually support the thing that couldn't be supported by state budget, like Global Fund, supporting a lot of work with communities. The CFCS works with the communities. So another point that need attention is also the readiness of the beneficiaries. Because when we have all the funding, we have to make sure that the recipient of this funding is able to manage the funding, could be accountable for the funding, and could actually implement it so we actually achieve the target. So that's also the area that need investment in the beginning to make sure that when funding is available, the recipients also ready to accept that and to operate that. So I think I would just stop there.
Thank you, Nura. Thank you so much. Obviously, you cannot talk about Stop TB Indonesia without mentioning late Arya Panigoro, whom I met personally too during our board meeting in Indonesia. That was in 2019. Yes, I heard you in terms of what we need to get there, which is very important, and also understanding your funding gaps in terms of balancing your domestic finances and also the external funding that is coming. Dr. Moa, I think I'll bring you in now. Please, if we can keep the intervention very short, 3 minutes, because I know some of the panelists need to leave early. So I give you the floor, please. Yes, 3 minutes, please.
Thank you, Chair. Dear panelists, ladies and gentlemen, I just have a few thoughts. I'm thinking how could I make my intervention in this very short period. First, I would like to say that I support all the main points mentioned by our panelists. I totally agree with that, together with our coordinator. So, all the good points. So, let me start with, I will be saying 3 things, 3 points. One, I think we agree that TB program, global TB program, national TB program are underfunded. Need to find more fund. We have these clear point, challenge, and strategy. So, strategy, led to my personal view, is quite clear. But it's time to go down to action. How to take action? How to help country move forward in terms of getting more money, let's say in simple terms. How to make it as, because as me as a former NTB manager, working with TB for quite long, 20 years or more, so I could say that now it's time to go down to the country. In simple that, how could the global community, TB community, the national, or how could these people help the country to move ahead? And our panel already mentioned about checking NSP, gap analysis, financial analysis, investment plan, whatever. So we should take action. Point number 1. Point number 2, I think to Lucica and the global team, I think it's time to look at the way toward 2030. Because the current strategy, the NTB strategy, 2016-2030, so we are now more than midway. It's time to look at how could the global level have a more longer term plan than the previous one, just 5 years, 3 years, but it's time to kind of revisit or assess the progress here today. So we are, let's say, walking from 2016 to now 2024. And we are now looking toward 2030. So it's time to look at more longer strategy or revisit, revise, what you call at the global to see how, and then make some kind of rolling plan or whatever you call, or even 5-year plan as before. I don't know. But it's time now to, and the year beyond. Because when we are approaching the goal, the timeline of eliminating TB by 2030, we should look at the so-called peri-elimination time. So 2 years before and 3 years after. Meaning mainly the so-called last mile strategy. It might be too early to talk about the last mile strategy, but it could be better to start thinking now. How could the global development, and this you know that the success of the global development is from the country. That's why I was saying earlier on that first help the country to move and action. That I support allude that revisit this split, this whatever. And to tell you this point, as I'm a world country program manager, sometimes when global fund or the global will say, okay, let the country decide, oh, it's very hard because we are very too friendly to each other. The TB program, the aid program, then they will say, okay, let give your portion to us. No. In country, we are difficult. So the global should help the country and should, to some degree, I don't want to say this is a kind of top-down, but sometimes you should be, global should be a bit more top-down. Then, okay, let the country decide, talk each other. In some setting, culture like Cambodia, oh, they are not fighting each other. Believe me, no, they say friendly, okay, fine, oh, something like that. So I should end that. I still believe that we could end TB, my last point, if we join together. And then, let's say, more action. I talked to Lucica when I first met her the first day. Go to the country, help. Not just talking today. When I was a program manager, I always say, oh, Mario, or Leopold Blanc, go to the country to see the situation, sit with them. In the working group, I even tell the group that go and help their team expert, check, digest there's a plan gap, and then help them fine. Because in TB, you feel obviously we lack human resource, we lack consultant, we lack, I don't know whether there are now more consultant, more expert, but during my day or leadership and leadership, there are problem with that. When to find some people to help write proposal, very difficult. I should end this point. Thank you.
Thank you, thank you. Well, thank you very much. Obviously, I have the same belief that we can end TB. That's why I'm in this room. If not, I would have been in my farming. But again, when we end TB, we'll probably look at other professions to do as well. So I want to bring in Dinesh. Obviously, you heard from Moa. He said that we need to be strategic and again monitor progress towards HLM 2027 and tie it with our global plan, which obviously I know a lot of you know the global plan to NTB 2023 to 2030. We have it, we made it more accessible. You can even download the app and you can find it on your phone, make it very easy. So Dinesh, I'll bring you now from the ADB. Obviously it's money, but you can first of all tell us about what you discussed in your group so that top three. Thank you.
Well, thank you, and a great thank you for inviting me in this conference. Let me start with one observation. I work in 27 countries in Asia Pacific. None of the countries when I go say that TB program is underfunded. While everyone here is saying TB program is underfunded. Where is the gap? Now, let me start with my own soul searching. We at ADB also have not sensitized our people to talk about tuberculosis. When we go, we talk about health system strengthening. We talk about pandemic preparedness. We talk about non-communicable diseases. But I'm not sure if I, in my last 3 years, have gone to any country and asked, what are you doing on TB? What are your targets on TB? Where are you standing? So let me own that the fault starts from my end. But at the same time, when I reach the country, they are, somebody said in the morning, they talk about NCDs to a good extent, yes. But they haven't ever opened up about tuberculosis. So my perception was that we have Global Fund, we have GHIT, we have BMGF who are already financing it and there is no gap. Now, this is an eye-opener for me that we have a gap and there's a scope where we can work together. I think if I analyze where we have lost it is we have taken a systems approach. We say we will go for universal health care, while TB has been always a vertical program. Somewhere in that horizontal and vertical thing we got lost. ADB got lost, perhaps countries also got lost. I can assure you one thing, I will go back to my management and say that we will like to work on TB again. We can put about $1 billion in next 3 years as resources for TB and work together with all the partners sitting on the dais here. That's a mandate which my Director General has asked. I just wanted to say ADB has got reorganized. Now we have all the sectors working together under a DG. We have under the G20 done reforms to create more headroom for financing. And I can assure you, I will go back to the management to say that this could be one of our priorities. But I will require support of everyone sitting here. We will require catalytic financing, working closely with you. We need to tell countries that if $1 of, financing from Global Fund or grant from Global Fund, $10 we will bring from the bank, maybe World Bank or ADB together. But we will work together so that the gap is bridged for supporting TB here. We can work on human resources. We can work on equipments, diagnostics. Like for example, I understand TrueNat is not only for TB but can also be done for other things like HPV and other diagnostic diseases. Then why not build it as part of UHC platform? That this is going to help us. I borrow a line today in the morning when somebody said, And when I was a medical student, I used to learn that TB is a proxy of primary health care. It starts from advocacy, it starts from house-to-house visit, it starts from screening, diagnostic, treatment. We are coming up now with AI-based X-ray Cure IT I was discussing, which can be such a fabulous tool to miss out the latent infections, treatment, resistant-based treatment. So TB touches every spectrum of our primary health care or health in general. But somehow we just missed that and we started talking about healthcare strengthening without talking particular about TB. I think the social health insurances need to be further incentivized and aligned to see that out-of-pocket expenditure due to TB goes down. TB can be a very high catastrophic disease if not done properly. So we at ADB have come up with a health sector directional guide. Maybe Jay, you can share with the whole team here, 2022 to 2030, where we have now put TB as one of the priorities, eradicating TB and working with the countries together. I will solicit the support of Stop TB Partnership, Global Fund and all people sitting here. If we can work together, when we go for even our missions, we can talk to the country and that hidden demand, perhaps which is lost somewhere in the discussions, can come up. And we are here ready to support eradicating TB from area. Just one last line. We are a regional bank, Asia Pacific Bank. And when I was studying the statistics of the top 7 countries in the world having TB, India, Indonesia, China, Philippines, Pakistan, Bangladesh, and the 7th is Nigeria. Of the 7, 6 are lying in our region where we are ready to work together and support this. Thank you.
Thank you so much, Dinesh. I mean, this is very interesting, and my heart is just warmed up again. If you look at the regional dialogue logo that we have, it shows that we are working together. You see all the hands working together? Yes, and our mantra in TB community is leave no one behind. And it's really worked for us. So for me, I think it's a challenge that you actually put to the leadership, to the secretariat. Luchika, Sahu, I think you have a lot of work to do. And when Dinesh was signing the board outside, I told him this signature will provide $20 billion to TB. And it's really working already. So thank you very much for that. Now I'll bring in Riole from the Chill Lungs. I know you also participated in a group, but you can also share what the group discussed and probably tell us a little bit about what you can do. But probably we can start from there. What you expect both government, private sector, banks to do as well. Thank you.
Good morning once again. I would like to add to what my group mate already discussed. I would like to speak on behalf of my network. In March 2023, PASS TB released the first ever community report by people affected by TB, entitled Towards a People-Centered TB Response in the Philippines. The report was born out of the results from the survey that used the human rights scorecards that PASS TB developed. The community report showed that around 60% TB survivors surveyed paid for their X-ray, amounting from 150 to 400 for about $3 to $8. Most of those who paid their X-ray were treated in the public healthcare facilities. 60% of them reported being unemployed, while 40% had no income. While TB treatment is provided at no cost to patients, other expenses of TB-affected households can hurt finances and their well-being, as if it affects their economic, mental, and social status. catastrophic costs do not only end after people are cleared from TB. In my many years of working for TB program, I see the need to increase TB financing. I have seen that local government units still lack TB medicines for children. Continued TB drug stockouts, TB patients still paying for their x-rays, lack of programs or supports for TB patients who lost their job while on TB treatment. My country needs to increase domestic funding for TB. LGUs need to invest in TB response and should also consider funding civil society organizations. Why? There is a lack of support for CSOs and volunteer organizations that work on TB prevention education and contact tracing. We, the TB-affected community, are very willing and passionate to help improving TB services. But we need also financial support to sustain our daily needs and those of our families. We are willing to work as volunteers, but I don't know until when we can sustain spending our own money for this work. On behalf of the past TB and the TB-affected community, I would like to extend my heartfelt thank you to Stop TB Partnership, to the Global Fund, to the USAID, and the donors who invest in TB. We cannot continue our work without the donors, the private sectors, the DOH, and other relevant agencies. We believe that multi-sectoral participation and accountability are critical components in TB elimination efforts. We, the past TB, composed of 27 civil society organizations working across 15 regions in the Philippines, calls for our government to multi-sectoral actions with decisive leadership and accountability.
Close gaps in TB response, TB prevention, treatment, diagnosis and treatment, and care by reaching all TB people with TB. Okay. I'll start. We call on the government to commit to multi-sectoral actions, decisive leadership, and accountability. Close gaps in TB prevention, diagnosis, treatment, and care by reaching all TB people, all people with TB. Sorry.
End TB as stigma and discrimination.
Amend Philippine TB Law. Hashtag TB Law na makatao. Invest the funds necessary to end TB.
With this, yes, we can.
End TB.
Together, everybody now, yes, we can end TB.
Yes, we can. NTB, yes, we can.
NTB.
Yes, we can.
NTB.
Thank you very much. Thank you. Thank you. So, Dinesh, I come back to you. I'll go right this way. Just tell us, what you can do personally. I know you've said something already, but again, just to reiterate it, tell us what you can do personally to support financing for TB. Thank you.
I think let's start from understanding this. Maybe I've already offered that we should start a MOU with NTB partnership. We're already concluding an MOU with Global Fund now. I think it's in the final stage. That's a way to start. We will like to understand and visit countries together to see the felt need of the people. As I mentioned, there's some gaps in the translation of what is required and what is not required. Perhaps as ADB had this impression that this space is adequately funded, perhaps countries also feel that this is not the area where ADB will invest. I think that's a myth which we need to bust. My myth got busted very recently, so I don't find fault with anyone here. We need to actually go as partnerships, work together. We are ready to invest resources in technical, in hiring consultants, working with your teams to feel what is required and where we can come and invest. We are part of the health system strengthening, pandemic preparedness, human resources, diagnostics. So the entire stream I can see, we will be ready to support that, and provided we articulate well, discuss with the countries. Just to tell everyone that our financing is demand driven to the countries. So we need to take countries with us, but at the same time at our end, we need to sensitize our ADB international staff also to work on eradicating TB. Thank you.
Just pass on the mic. Just 1 minute. Tell us what you can.
Only 2 points. From my personal action, I will be talking with our NTP colleague and partner in the country on these point of pain very clearly. Second point, we will be waiting for our global community, bank level, regional level to visit our country. We will be waiting for the whole year of 2024 to receive our in Siba. Thank you.
So I think I would just to add that maybe in some cases the TB program need follow the current money, but we really need to think how we can invest right so the money will really follow the program that is needed to make the 2030 elimination can really be achieved.
I think along the line, spending more, spending better, and spending right for TB is important. And one way to do it is for us, I think, as financiers, is to work together to find more collaborative efforts to support country to fight TB. So together we can end TB.
So recognizing the top killers of a single pathogen, we also need to understand the acceleration of this research and development and access and delivery. At the same time, we also need to put this the TB all kind of programs and interventions in the health system. So we need to have both the partnership, power of partnership really need to be gathered, and also it is very key to end epidemics. Thanks.
So I would say when it comes to finance, it's not the issue of either or. It's both and. So we need domestic funding, we need international funding, we need external funding, we need all the funding. And I think when it comes to international funding, I would say for Global Fund, it's not really about money. It's the change which is being catalyzed in the country. The idea of CCM, government sitting with civil society. I remember when I was working with the government, when the Global Fund came, we refused the government. We cannot have the same voice as the patient. We saw ourselves as here, but now it's normal for government to sit with patients, civil society, to be able to discuss at equal level. So this is kind of catalyst movement which is coming with all this international. So we need both funding. We need all the hands in the deck.
For us, it's just really simple, and I would like to take on from what the Secretary of Health yesterday has always been mentioning, that every life is important, every Filipino life is important, and therefore investments, finances, it's not just really a matter of value or a money amount in dollars or pesos, but it's really investing in lives of people and investing in the lives of our future generation. Thank you.
Thank you. On that note, I want to say every life is important and every life is worth fighting for, and we need all the money. I want to say thank you, obrigado, gracias, salamat po to all my panelists. Please a round of applause while they exit the stage. Thank you. Thank you. Thank you very much. Oh, okay. So let me invite Sahu, the Deputy Executive Director of the Stop TB Partnership, to give us a housekeeping update for the next section. Sahu, thank you.
So this was an excellent panel. Now, please note there is a slight change in the agenda. The change is being done to ensure that we do the work in an efficient way and we try to finish early. So after this, immediately, now it is 11:40, so we proceed into the group work, proceed into your respective groups. You remember the A, B, C, D, E, your groups. Please go into those rooms. We will have 1 hour of group discussion on the next thematic issue, which is action that are required to achieve the UNHLM targets. Then we break for lunch around 12:40. Lunch will be 12:40 to 1:40 or maybe a little bit more. We reassemble here in the plenary at 2 p.m. for the last panel, the action panel. 2 p.m. plenary here, and group work now in your respective groups and in between lunch. Now, please, one more information. Some of you in the room were requested to be part of a ASEAN informal discussion on a new project. So the ASEAN group who have been invited, please follow Liz, if you can raise your hand, Liz, because there is a separate room for them after the group work. After the group work, Liz, if you can come to the group work rooms, you know her, so she will guide you to the separate room where the ASEAN invited people will meet for an informal discussion over lunch. So, to repeat, please go now to your respective groups and then go for lunch immediately after. Come back here 2 p.m. Thank you.